Pressure around the rectum and pelvic floor dysfunction is a subject of this video, so stay tuned. Hey, this is Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County. One of the most common things I see among patients that come in with pelvic floor dysfunction is pressure around the rectum, or feeling like they need to go to defecate, to poop, and it's just heavy there, but nothing happens. Well, there are multiple reasons why that happens, but if I were to give you a general idea as to what's happening, I can tell you that there are a lot of sensors in that area. There are nerves that kind of go weave in and out of muscles in the floor and around. So if this is your pelvis, the floor is at the bottom and the walls of the pelvis do have muscles. There are nerves that weave through and come out, and we've done videos on that. You can check out the channel to understand more about it. But bottom line here is there are a lot of structures that can be compressed and be unhappy, from nerves to blood vessels, to muscles, contraction, or too much relaxation. So when you have pressure around the rectum, it's fair to say that the muscles, to say the least, the muscles are not balanced. So then the question is, why are they not balanced? The next step is because the pelvis is not balanced. If pelvis is like a bowl with the muscles lining the whole inside and the bottom of it, with the spine connected at the top, with the legs connected to the bottom, if this bowl is not sitting nice and balanced and it's tipped forward or backward over time, and that's not a long time, we'll say a week, that creates, the body has to adjust itself based on that presentation. Based on that off-balance presentation, you're creating more and more and more layers of issues. So when that happens, one of the things that takes place is that abnormal sensation that we're having. It may be that the muscles are contracting too much or not contracting enough. So what do we do in the office in cases like that? Full-on evaluation of what is happening, not internally. We don't even go internally to see what's happening to the pelvis. We don't need to. There are so many clues externally that point us in the right direction that we don't need to go in. And when it comes to treating the individual, almost always, by the time we're done treating the balancing of the pelvis, all the problems are gone. So occasionally we may refer out for internal assessment. For how many times has that happened? I'm gonna say 2 or 3 times. So pay attention to whys before you jump in to get a treatment and try to figure out who to go see. It is important to go see the right people, otherwise the problem becomes more chronic and more issues will take place. If you have any questions, make sure you use one of the contact methods in the description box to contact our office. Make sure you subscribe to the channel and follow us on social media. Until next time, take care.